But in terms of what evidence do I need, I suppose it depends on what level I'm working at. If I'm working at a GP surgery level and the budget is readily accessible, I suppose, and doesn't need to go through the same processes that the ICB needs to, actually maybe the evidence doesn't need to be as strong, and maybe I can take a chance on something that maybe isn't as worked up or thorough. But I'm not sure that's necessarily true either. I think the reality is what you're dealing with is a health system that is under strain, as every health system is in the world, I'm sure. And so people don't always have the time to spend taking your product and implementing it and working out the nuances around its implementation. How are we going to do it? Who is it going to speak to best of all? There will be some willing to take that chance, but there's not many. So I think if you are going to access this system, you need to have worked with some partners who are in that industry, who have done it, who have helped you implement it, who have worked up the solution with you. So we've said case studies, but I think that probably is right. You want to be hearing from someone that has implemented their solution within maybe a clinic setting, got some data to say how it's performed, identified ways in which it meets my needs and maybe improves my efficiency, give me some value that I can understand. So for example, a 30% efficiency in new patient registrations means I can work out how much money that's going to save my practice, and if you can work it out for me, then even better. So you need to have some of that work already done, and I think that's the thing that I'm seeing at the moment that isn't there. People are trying to get in, they want free pilots of their products, and the work hasn't been done around how do we implement this product. What work have we done to identify if it actually works? What work have we done to identify which populations and which communities will benefit most from that? And what work have we done to understand where else in the system this change has benefited? And I think that's the other thing to bear in mind. We work in a system. So whatever we implement in one place will likely have impact somewhere else. And actually, if you're developing an innovation, that's really good to know, because you can say that I've improved the efficiency within a GP surgery, which has then created 25% more capacity for appointments in that GP surgery, which means there's fewer patients having to revert to going to A&E or emergency departments, which is then putting budgetary pressures and clinical safety risks within a hospital environment. So it really is important that you are thinking about the wider system benefits of your product, which I suppose goes to the middle item there in terms of localized pressure there. And then obviously health economics comes along with that too. So what's perfect if you want to sell to an ICB or actually to anybody and you want your product to really gain traction? How does it help the patient? How does it improve the quality of the service that the patient is experiencing? How does it allow us to deliver that service in a more efficient way, which then has some financial benefit in terms of service delivery so that we can spend our finite resources on helping more people? How does that change help a practice, a GP surgery? Maybe it's reducing the number of appointments and therefore creating new capacity. And then how's that helping the system? Because we've created one capacity in one place, we've reduced the pressure somewhere else. And actually, when you're getting into that level of detail and understanding and work and rigor, then you've made a really good argument to an ICB to say you need to employ this across our patch. And then you're talking about a deployment across a huge population. And then if it works in one ICB, maybe it works for all ICBs. And in which case, why haven't you got national uptake of your solution?